Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation covers information regarding Hepatitis A, Hepatitis B, and Hepatitis C. Hepatitis is inflammation of the liver. The liver functions to process nutrients, filter blood, and fight infections. When the liver is inflamed or damaged, it is unable to properly function. The most common hepatitis types in the United States include Hepatitis A, Hepatitis B, and Hepatitis C. First, we will discuss Hepatitis A. Hepatitis A is a highly contagious liver infection which is caused by the hepatitis A virus, or HAV. Hepatitis A causes liver inflammation, which can affect the liver's ability to process nutrients, filter blood, and fight infection. The illness may range from mild to severe, although it does not become a chronic infection. Not all hepatitis A cases are diagnosed, and therefore it is underreported. There was more than a 95% decline in cases from when the vaccine became available in 1995 until 2011, but there was a 140% increase in cases between 2011 and 2017. It is estimated that there were 6,700 cases in 2017. A multi-state outbreak began in November 2017, which you can see the spike of cases on the right graph. Hepatitis A infection is spread person to person through the fecal-oral route. This may occur through being passed through food prepared by an infected person, sexual contact involving stool with an infected person, mouth contact with contaminated objects, and through contaminated water or food. The virus can live outside the body for months. The incubation period for hepatitis A averages between 28 to 30 days, with a range of 15 to 50 days. Some people have no symptoms at all, and that's typically in children younger than 6. For those who do have symptoms, it may include nausea, vomiting, fatigue, abdominal pain, fever, dark urine, pale clay-colored stools, diarrhea, joint pain, loss of appetite, and jaundice or yellowing of the skin or eyes. It is infectious, therefore can be spread to others from about 2 weeks before to about 2 weeks after symptoms end. Symptoms usually last less than 2 months, although 10 to 15% of people may be symptomatic for up to 6 months. Hepatitis A may be diagnosed with a combination of methods, including a physical examination with history, symptoms, and blood tests. There is no specific treatment for hepatitis A. You can only treat the symptoms. This may include rest, staying hydrated, and eating healthy foods. Be sure to avoid other medications without your doctor's approval. This also includes alcohol, as it may further damage the liver. Follow up with your doctor during the illness as well. Most people recover within 2 months. After recovery, you will have immunity and will not need a vaccine. Hepatitis A does not become a chronic condition. Risk factors for hepatitis A may include injected or non-injected illicit drug use, homelessness, being incarcerated, men who have sex with men, close contacts of people who have hepatitis A, and travel to certain countries, such as places with poor sanitation and limited access to clean water. Hepatitis A complications may be more likely in certain populations, such as those who are immunocompromised or have other chronic liver infections. People may need to be hospitalized for acute liver infection with hepatitis A. Rare cases may even lead to acute liver failure with a possible need for liver transplant. Death is rare, but it is possible. You should seek medical care if you have been exposed or you think you have been exposed, if you have symptoms of hepatitis A, or if your symptoms worsen. There are many ways to prevent hepatitis A infection, and one of the biggest is to receive the vaccine anytime at or after age 12 months. If someone is susceptible and exposed, they may receive the vaccine or immune globulin, or IG, which is an antibody-containing substance from human plasma, within 2 weeks of exposure to prevent infection. You should also follow good hand washing with soap and water. after using a restroom, after changing diapers, before, during, and after food preparation. Wash produce before consuming or cooking it. Use treated water for any food or drinking preparation. Be sure to take precautions while traveling outside of the United States, such as using bottled drinks and not using local water or ice for food, drinking, or brushing your teeth. Do not consume uncooked produce unless it is peeled yourself, and do not consume food or drinks from street vendors. You can also prevent the spread to others by not going to work or school while you are sick, not changing diapers near recreational water, practicing good hand washing, not preparing or serving food for others while infected, avoiding sexual activity while infected, and following isolation either at home or in a separate area in facilities such as jails. Next, we will discuss hepatitis B. Hepatitis B is a serious liver disease caused by the hepatitis B virus, or HBV. It may be acute, in which it is short-term and lasts up to 6 months, but it can lead to chronic infection. A chronic infection is long-term and occurs when the virus remains. It occurs in about 5 to 10% of all those who are infected after age 5. It occurs in about 25 to 50% of those who are infected between ages 1 and 5, and it occurs in about 90% of those who are infected at birth. It can cause long-term health problems. It is estimated that anywhere between 850,000 to 2.2 million people in the United States are chronically infected with the hepatitis B virus. Over 22,000 new cases were estimated to happen in the United States in 2017. There has been a decline in new cases since 1991 due to routine childhood vaccination recommendations. Hepatitis B is spread through infected blood or body fluids entering the body. This may happen through sexual activity, through sharing needles or drug equipment, sharing personal items such as razors, toothbrushes, and nail clippers, through tattoo or piercing from infected needles, accidental needle sticks, contact through open sores, and it can be passed on during pregnancy and birth, and 90% of those who are infected as infants become chronically infected. The virus can live outside the body for at least 7 days. Hepatitis B is not spread by food or water, sharing eating and drinking utensils, breastfeeding, hugging or kissing, coughing or sneezing, or any other casual contact. Some people infected with the hepatitis B virus have no symptoms or very mild symptoms, although they can still transmit the virus to others. Hepatitis B is sometimes known as a silent infection. You may not have symptoms with a chronic infection until complications develop later in life. If someone is symptomatic, symptoms usually appear between 60 to 150 days after exposure. If symptomatic, this will include jaundice, loss of appetite, nausea, vomiting, fever, pale stools, abdominal pain, joint pain, fatigue, and dark urine. Hepatitis B infection may be diagnosed through physical examination, symptoms, medical and risk behavior history, family history, and blood tests including liver function tests and antigens and antibodies. This testing can tell if the infection is acute, chronic, a past infection, or immunity. It is recommended that pregnant women are screened for hepatitis B during each pregnancy. There are other tests to assess liver damage, such as liver ultrasound, further blood testing, or a liver biopsy, in which a thin needle is inserted through the abdominal wall to remove tissue for lab testing. There is no cure for hepatitis B infection. Some people are able to clear the virus naturally, while others develop chronic infection. For those who do clear the virus, the body develops antibodies for immunity. It is possible to have hepatitis B virus reactivation later in life, although that usually only happens in those who are otherwise immunocompromised. With an acute infection, you may treat the symptoms, including rest, adequate nutrition, fluids, and medical monitoring. To treat chronic infection, there are oral or injectable antiviral medications for some people. This may help slow the progression or decrease the viral load. Once medication is started, it is needed for the rest of the person's life. A liver transplant may be an option if the liver is severely damaged. Risk factors for hepatitis B infection include being unvaccinated, babies born to hepatitis B virus-infected mothers, illicit drug users, multiple sexual partners, men who have sex with men, those who are HIV or hepatitis C positive, having worked or lived in prison, household contacts with someone who is hepatitis B positive, those who are on kidney dialysis, being immunocompromised, having received a blood transfusion or organ transplant before the mid-1980s, being a healthcare worker, and being born in or living in certain parts of the world, including Africa, Asia, parts of Europe, Middle East, and South and Central America. Complications of hepatitis B virus infection may include increased chance of contracting HIV, cirrhosis or scarring of the liver failure, liver cancer, kidney disease, and death later in life in about 25% of those chronically infected during childhood and in about 15% of those who are chronically infected after childhood. You should see a doctor if you are at risk for hepatitis B, if you have been exposed to hepatitis B, if you are symptomatic, if you've already been diagnosed for routine care or for worsening of symptoms, or just if you want to be tested. There are various ways to prevent hepatitis B infection. Hepatitis B vaccine is now given at birth, but it can be given later if someone did not receive it at birth. If someone is susceptible and exposed, they may receive the vaccine or immune globulin, or IG, which is an antibody-containing substance from human plasma, preferably within 24 hours. For babies born to hepatitis B infected mothers, they should receive hepatitis B vaccine and IG within 12 hours after birth. They should then continue the hepatitis B vaccine series, and it is recommended that they are tested after the vaccine series to make sure that they are protected. Always use condoms and follow universal precautions when there is potential for contact with blood and bodily fluids. This may include gloves, masks, and gowns as needed, and cleaning up blood with 1 part bleach and 9 parts water. Don't use illicit drugs, but if you do, don't share needles, syringes, or items inserted into the nose. Always use new, sterile equipment and only handle your own equipment. Be sure to visit licensed tattoo and piercing shops. If you are infected, prevent the spread to others by covering your wounds, throwing out anything covered with blood yourself and not letting anyone else touch it, not sharing razors or toothbrushes, not donating blood or semen even if you cleared the virus, although you may be able to donate some organs, eyes, or tissue. Inform healthcare workers of your hepatitis B virus status. Inform sexual partners and always use condoms. Inform household contacts and family members, and encourage possible contacts to be tested. Following a hepatitis B diagnosis, there are many things that you can do to remain healthy. Stop drinking alcohol to slow the progression of liver disease. Avoid medications affecting the liver, and be sure to talk with your doctor about any over-the-counter and prescription medications, herbal and dietary supplements. Follow routine physician care. You may be seen by a specialist, such as a gastroenterologist or hepatologist. Obtain all vaccines recommended by the doctor, especially hepatitis A vaccine, to prevent further liver infections. Follow your treatment regimen as prescribed, and follow a balanced, healthy diet. Get support to help with physical, emotional, and psychological effects through family, friends, support groups, and therapy. Finally, we will discuss hepatitis C. Hepatitis C virus, or HCV, is an infectious inflammatory viral liver disease. It may be acute, in which the infection is short-term and occurs within 6 months of exposure, or chronic, in which it is long-term and occurs when the virus remains. It may progress over years, and you may not know that you're infected until liver damage develops later. Chronic hepatitis C infection occurs in up to 85% of all hepatitis C cases. Hepatitis C virus infection is the most common bloodborne disease and the leading cause of liver transplant. It is estimated that about 2.4 million people were chronically infected in 2016, and about half of those may not know. Over 44,000 new cases were estimated to have happened in 2017. Genotype 1 is the most common, followed by genotypes 2 and 3. Hepatitis C infection is spread through direct contact with blood or bodily fluids. This may happen through illicit drug use, sexual contact, sharing personal items such as toothbrushes or razors, being born to a hepatitis C infected mother, or medical injuries such as an accidental needle stick. The virus can survive in dried blood for several days. It is not spread by sharing eating and drinking utensils, coughing or sneezing, hugging or kissing, casual contact, and breastfeeding, although perhaps you should temporarily stop breastfeeding until you talk to your doctor if your nipples are cracked or bleeding. About 80% of people infected with hepatitis C infection have no symptoms but can still transmit the virus to others. If symptomatic, the symptoms usually appear between 2 to 12 weeks after exposure, with a range of up to 6 months. When present, symptoms may include jaundice, dark urine, clay-colored stools, abdominal pain, loss of appetite, weight loss, nausea, vomiting, fever, fatigue, headache, and joint pain. Hepatitis C infection may be diagnosed using a combination of methods. This can include a physical examination, medical and risk behavior history, symptoms, and blood tests. Abnormal liver function tests may show up, and levels may go up and down over time with chronic hepatitis C infection. Antibody screening may be done as well. You may not react if you have been exposed within the last 6 months, or you will still react even if you clear the virus in the past. Confirmatory testing may include the viral load, such as the RNA, NAT, or PCR, to show the amount of virus in the blood. If someone is antibody positive and viral load negative, it is recommended to be retested. Genotype testing may be done to test for the specific hepatitis virus type. This is important in determining treatment. Other tests to assess liver damage may include magnetic resonance elastography, or MRE, which combines MRI with sound waves, transient elastography, which is ultrasound transmitting vibrations, or a liver biopsy. About 15 to 25% of those infected with hepatitis C infection clear the virus naturally. There are oral or injectable antiviral medications depending on viral genotype and previous treatments received. There are multiple options available and may range from 8 to 24 weeks. There is over a 90% success rate for those who complete treatment. The goal is to have no detectable hepatitis C virus in the body at least 12 weeks after treatment completion. You can also treat complications, such as using diuretics to remove excess fluid, blood pressure medications to relieve pressure in the portal vein leaving the liver, tube compress and medications to stop and prevent bleeding in the esophagus, medications to clear the body of toxins, chemotherapy, radiation, or surgery to treat liver cancer, or liver transplant for serious complications and damage. A liver transplant does not cure hepatitis C, though. Antiviral medication is still needed to prevent damage to the new liver. There are multiple risk factors for hepatitis C infection. These may include ever having used injectable drugs, sharing drug equipment such as syringes, needles, cookers, cotton, or tools for inhaling, which may have been contaminated with blood, having received blood products, or organ transplants before 1992, or at any time from someone who tested positive for hepatitis C, receiving clotting factor concentrates before 1987, having received long-term kidney dialysis, being infected with HIV, being a healthcare worker with frequent blood contact or having had a needle stick injury, being born to a mother with hepatitis C infection, and it is recommended not to be tested until after 18 months of age, as the infant may still have maternal hepatitis C virus antibodies. Living with or caring for someone with hepatitis C, although risk to casual and household contacts is very low. Sharing personal items with someone who is hepatitis C positive, and this includes items which may have been contaminated with blood, such as razors or toothbrushes. Having unprotected sex with someone who is hepatitis C positive, especially if you are engaging in multiple sex partners or in rough sex. receiving a tattoo in unsanitary conditions or with non-sterile equipment, having ever been in prison due to high infection rates and common risky behaviors in those who are incarcerated, being a Vietnam War era military veteran, as you may have been exposed to infected blood through various routes, being born between 1945 to 1965, as you are 5 times more likely to have hepatitis C than other adults. You may have been exposed before current infection control procedures were available. Hepatitis C infection can lead to serious complications, including cirrhosis or liver scarring, which occurs in 10 to 20% of those chronically infected over a period of 20 to 30 years. Cirrhosis can cause swelling in the legs and the abdomen, enlarged blood vessels in the stomach or esophagus, which can burst and cause internal bleeding, enlarged spleen, gallstones, increased drug sensitivity due to the decreased ability to filter the blood, insulin resistance, kidney or lung failure, decreased ability to fight infection, cognitive problems, or coma. Hepatitis C infection can also lead to liver failure, liver cancer, or death. You should see a doctor if you are at risk for hepatitis C, if you have been exposed to hepatitis C, if you are symptomatic, if you have already been diagnosed for routine care or for worsening of symptoms, or just if you want to be tested. There is no vaccine available for hepatitis C prevention, but there are other methods. Don't use illicit drugs, but if you do, don't share needles, syringes, or items inserted into the nose. Always use new, sterile equipment, and only handle your own equipment. Only go to licensed tattoo and piercing shops, and always use condoms. Follow universal precautions when there is a potential for contact with blood and bodily fluids, such as using gloves, masks, and gowns as needed, and if you are infected, preventing the spread to others. This can include covering wounds, throwing out anything covered with your own blood yourself and not letting anyone else touch it, not sharing razors or toothbrushes, not donating blood or semen, although you may be able to donate some organs, eyes, or tissue, always informing your healthcare workers of your hepatitis C virus status, informing household contacts and family members, encouraging possible contacts to be tested, and informing your sexual partners and using condoms. Sexual transmission between long-term monogamous couples is a lower risk but may still happen. They should decide together whether or not to use condoms. Following a hepatitis C diagnosis, there are things that you can do to maintain a healthy lifestyle. Stop drinking alcohol to slow the progression of liver disease. Avoid medications affecting the liver, and talk with your doctor about over-the-counter and prescription medications, herbal and dietary supplements. Seek routine physician care. You may be seen by a specialist, such as a gastroenterologist or hepatologist. Obtain all vaccines recommended by your doctor, especially hepatitis A and B vaccines, to prevent further liver infections. Follow your treatment regimen as prescribed. Continue to follow a healthy lifestyle even if you clear the hepatitis C virus naturally or medically to prevent reinfection. Follow a balanced diet. Get support to help with physical, emotional, and psychological effects from family, friends, support groups, and therapy. There are no job exclusions based on hepatitis C virus status. It is important to know that you are never immune to hepatitis C. You may become infected with a different genotype, or if you previously cleared the virus, you may become reinfected with the same type. This concludes the ABCs of hepatitis presentation. If you have any questions or concerns, please follow up with your doctor or contact your local health department. Here is a listing of various references that provide helpful information as well. Thank you.